Hello, friends, and welcome to episode 1258 of the Juicebox Podcast. Welcome back, everybody. This is all of the diabetes news that I found interesting for this week. I hope you enjoy it. Nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan. I was looking for a way that we could all get nice and tan and meet each other and spend some time talking about diabetes. How are we going to do that? On a Juice Cruise. Juice Cruise 2025 departs Galveston, Texas on Monday, June 23rd, 2025. It's a 5-night trip through the Western Caribbean, visiting, of course, Galveston, Costa Maya, and Cozumel. I'm going to be there, Erica's going to be there, and we're working on some other special guests. Now, why do we need to be there? Because during the days at sea, we're going to be holding conferences. You can get involved in these talks around type 1 diabetes, and they're going to be Q&As. Plenty of time for everyone to get to talk, ask their questions, and get their questions answered. So if you're looking for a nice adult or family vacation, you want to meet your favorite podcast host, but you can't figure out where Jason Bateman lives, so you'll settle for me. If you want to talk about diabetes, or you know what? Maybe you want to meet some people living with type 1, or just get a tan with a bunch of cool people. You can do that on Juice Cruise 2025. Space is limited. Head now to juiceboxpodcast.com and click on that banner. You can find out all about the different cabins that are available to you and register today. Links in the show notes. Links at juiceboxpodcast.com. I hope to see you on board. What's up, everybody? It's July 19th. It's time for the weekly news. I wish we had weekly news music. Like old 50s music was like, beep, 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 beep. It's like, hey, there's going to be news now. Like something like that. Anyway, what do I got for you? That wasn't fun at all. Okay, now let's start with some mouse news, shall we? They're helping mice with diabetes again. Isn't that great? But this is kind of interesting. Let's see. What do I got here? Why won't it go back to what I wrote? Oh, here it is. Now, this is from newsatlas.com. Scientists have developed a new drug therapy that significantly boosts insulin-producing beta cells, offering potential for reversing diabetes. Here's some key points from the article. Keep in mind, this is work they're doing on mice. This involves harmine, inhibiting the DYRK1A enzyme in beta cells, and a GLP-1 receptor agonist like Ozempic. In diabetic mice, it says, human beta cells increased by 700% within 3 months, reversing diabetes symptoms. Let's see. Future research. Combine beta cell regenerating drugs with immune system modulators to prevent immune attacks on new beta cells. Interesting. Harmine alone has undergone phase 1 clinical trials with more trials planned. I'm going to find out more about that in a second. The procedure involves a combination of 2 drugs, Harmine, which inhibits the enzyme DYRK1A in beta cells, and the GLP-1. Harmine stimulates the proliferation of beta cells, while the GLP-1 receptor enhances this effect and supports beta cell function. In studies with diabetic mice, this combination led to a 700% increase in human beta cells within 3 months. Wow, that's pretty great. It says here, Harmine has undergone a phase 1 clinical trial. Tell me more about that. Tell me more. Phase 1 trial assesses the safety and dosage of the drug in small groups, healthy volunteers or patients. Trials involve close monitoring to observe any adverse effects, and to establish a safe dosage range. For Harmine, phase 1 trials likely focused on its safety profile, determining how well it is tolerated in humans and identifying any potential side effects. Harmine works by inhibiting the DYRK1A enzyme in beta cells. We know that. Okay. Current status and next steps. After successful phase 1 trials, the next steps would involve phase 2 and 3, of course. That's how counting works. These phases will test the drug efficacy in larger groups of patients, further evaluating its safety. And all right, well, so there's like 2 more rounds of safety. And then you're looking for regulatory approval. If these trials demonstrate that Harmine is safe and effective, the drug could eventually be submitted for regulatory approval. And if approved, become available for clinical use, which is how that works. Anyway, I thought that was interesting that they're mixing one thing with the GLP. I thought that was kind of cool. 2 bits of news from Novo Nordisk. One good, one not so good. Let's start with not so good. Novo Nordisk is working to address FDA requests regarding the approval of their once-weekly basal insulin icodec. The FDA has delayed approval pending further information on the manufacturing process and the type 1 diabetes indication. Novo Nordisk is actively working to meet these requirements, but does not expect to complete them within 2024. But here's the good news side. This is very interesting. Novo Nordisk recently received FDA approval for an additional indication of their drug Wegovy. That's the 2.4 milligrams semaglutide. The new approval allows Wegovy to be used to reduce the risk of major adverse cardiovascular events, MACE, such as cardiovascular death, non-fatal heart attack, and non-fatal stroke in adults and established cardiovascular disease and either obesity or overweight. So there you go, kids. There's another way to get your Wegovy. Break that Wegovy story down a little more. Need details. Let's see what our overlords say about that, shall we? There was a trial, randomized, double-blind, placebo-controlled trial. Participants, 17,604 adults aged 45 years and older with a BMI greater than 27. The duration of this trial was over 5 years across 41 countries. The objective was to demonstrate the superiority of semaglutide 2.4 milligrams versus placebo in reducing MACE, which includes cardiovascular death, non-fatal heart attack, and non-fatal stroke. Results significantly reducing MACE, supporting the use of Wegovy for cardiovascular risk reduction. Hey, well, it's nice. Wegovy indications for this MACE thing now, and of course for chronic weight management for adults with obesity, BMI greater than 30, or overweight greater than 27, with at least one weight-related comorbidity condition, and for pediatric patients ages 12 or older with obesity. All right, then. There's another way to get you some Wegovy. Hopefully you don't have any of those problems. I wouldn't wish them on you. But anyway, new news. You know what I mean? Stuff that's new in the world. Now you know about it. Last thing for today. There is a significant legal battle is unfolding against pharmacy benefits managers, which are colloquially known as PBMs, over their business practices and pricing schemes that allegedly inflate drug costs and negatively impact patients and pharmacies. Multiple lawsuits have been filed aiming to address these issues and seek restitution. Keep in mind, I just said to ChatGPT, tell me about the PBM lawsuits. It says here, class action lawsuit has been filed by NCPA member Matt Ostrenhouse against CVS Health, Caremark, and Aetna. The suit challenges the legality of direct and indirect remuneration, fees, and other practices under federal antitrust laws and state contract laws. The lawsuit also contests the fairness of CVS's arbitration agreements. I feel like I said that word wrong.
It should be remuneration.
Okay, yeah, what she said. Let's see. The Oklahoma Attorney General Getner, what a name, Drummond has filed a lawsuit against several major insulin manufacturers and PBMs alleging an unfair and deceptive pricing scheme. The lawsuit claims that despite the reduced production cost of insulin, prices have been raised exorbitantly, causing significant financial strain on patients. This lawsuit seeks restitution and aims to bring transparency and fairness to insulin pricing. The lawsuits, both of them underscore the ongoing struggle between independent pharmacies and PBMs over practices like DIR fees, which are often seen as unfair and harmful to smaller pharmacies. These legal actions aim to highlight and rectify these practices, potentially leading to significant changes in how PBMs operate and improve conditions for both pharmacies and patients. Well, that would be nice if things got better for us. I'm going to end today shining a light on Australia. You say, Australia, Scott? Why? Well, they're doing something cool down there. So July 14th to the 20th is National Diabetes Week in Australia. And the theme is Unite in the Fight for Tech, expanding subsidized access to continuous glucose monitoring and ensuring equitable access to diabetes technology across Australia. Good luck, everybody. I love that you're down there fighting that fight. There's some awareness campaigns highlighting the disparities in access to diabetes technology and advocating for changes, launching events and discussions featuring health leaders and political figures to raise public awareness and support for policy change. Australia and Diabetes Society seems like they might be involved. Looks like Diabetes Australia, along with Australian Diabetes Educators Association and the Australian Diabetes Society, will engage in advocacy efforts aimed at implementing recommendations from the Parliamentary Inquiry into Diabetes. This includes increased access to diabetes technology and support for credentialed diabetes educators. Good for you guys. Go ahead. If those spiders don't kill you, I hope this works out. Tickets for the 2025 Juice Cruise are limited. I'm not just saying that. They actually are limited. We have a certain window to sell them in, and then that's it. Juiceboxpodcast.com. Scroll down to the Juice Cruise banner, click on it, find a cabin that works for you, and register right now. You are absolutely limited by time on this one. I'm so sorry to say that. It sounds pushy, but it's the absolute truth. Juice Cruise 2025. I hope to see you there. We're going to get a tan, talk about diabetes, and meet a ton of great people who are living with diabetes. It's kind of going to be like floating diabetes camp, but you won't have to sleep in a log cabin. You'll get a tan, and it's not just for adults or kids. It's for everybody. Hey kids, listen up. You've made it to the end of the podcast. You must have enjoyed it. You know what else you might enjoy? The private Facebook group for the Juicebox Podcast. I know you're thinking, Facebook, Scott, please. But no. Beautiful group, wonderful people, a fantastic community. Juicebox Podcast, Type 1 Diabetes on Facebook. Of course, if you have Type 2 or you're touched by diabetes in any way, you're absolutely welcome. It's a private group, so you'll have to answer a couple of questions before you come in. We'll make sure you're not a bot or an evildoer. Then you're on your way. You'll be part of the family. Hey, thanks for listening all the way to the end. I really appreciate your loyalty and listenership. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. If you're newly diagnosed, check out the Bold Beginnings series. Find it at juiceboxpodcast.com up in the menu, in the featured tab of the private Facebook group, or go into the audio app you're listening in right now and search for Juicebox Podcast Bold Beginnings. Juicebox is one word, Juicebox Podcast Bold Beginnings. This series is perfect for newly diagnosed people.